give my ondansetron IM, okay? And then I can't do my documentation yet because I haven't given the medication, so I have to hold up on that. I don't know, what are my other items? Patient, time, dose. Okay, my metformin is gonna be 500. The insulin is gonna be 6, 10 for my NPH. Ondansetron is 4. Really, I have to hold on to that because I can't do anything with that until I get to the Pyxis or my MedCart and see what's available, because I might have to do some kind of dosage calculation, right? So I'm gonna kind of hold on to that. Now, additionally, what your instructor is gonna do is also give you a sliding scale. So you're gonna have to do some kind of additional calculation with your insulin, right? So I'll say, I don't know, 192, okay? So 192 of regular, I know I'm gonna have to give my patient an additional 2 units of insulin. So while I'm sitting here, I'm just gonna go ahead and calculate out how much insulin I'm gonna have to give my patient. So really, I would have like my little scrap piece of paper, because that's just how I roll, but I didn't cut up any. So regular, I know I'm gonna have to give 6 units plus my sliding scale. So that's gonna be 8 units of regular, and then my NPH is gonna be 10 units. Okay, so when I'm ready, I'm gonna say, okay, I'm ready to get up. I'm ready to go to my cart. I'm just gonna leave my order for my sterile procedure here. What did I do? I don't know, I can't even remember what I pulled. Foley, so I'm just going to circle my Foley really quick so I remember what I pulled, because I'm gonna forget. And then I'm gonna come over to my med cart and I'm just gonna pull out my meds. I'm gonna grab one of these little emesis basins so I can put everything in here. And so first I have metformin. So I'm gonna get my metformin. I needed 500 milligrams, 500 milligrams. Okay, it comes in 500 milligrams. I don't have to do anything else with my metformin. I'm gonna get my little med cup. I'm gonna place it in there. Next, I needed regular and NPH insulin. So what I'm gonna do is just grab a regular vial. I'm gonna grab an NPH vial. And I'm gonna put those 2 in there. And then I'm gonna grab ondansetron. Now I'm gonna check my dose since I'm here. And I was giving 4 milligrams, and this comes 4 milligrams every 2 mLs. Now, that kind of worked out, so I don't have to do any dosage calculation, but you will have to do some type of dosage calculation, okay? So I am set to go on all my meds, but what I need to do is gather my supplies so I can get my meds. So, put that in there. I'm gonna get you a little piece of meat, whatever. You'll already have this over at your station. We'll have those for you. I'm gonna grab a cup, grab a straw, I'll grab these, my orders. Now, I'm giving 2 mLs IM, so I know I need a 3 ml syringe. I need a blunt tip needle. I need an insulin syringe, and I know that I'm giving my my IM, so I know that I need a long enough needle. So I'm gonna go ahead and grab 23 times 1 inch needle, because I know that that's gonna be okay. So I've got everything. The only thing that I didn't grab, because it's in the cart, is my alcohol swabs, and I'm going to take a bunch just so I don't have to come back, because then I have to take everything with me.
Did you say you grabbed a 24 gauge?
Yeah. And then I've gotten some, what do you call these?
Labels.
Labels. And I'm not going to actually pull anything up, so I'm just going to grab everything. So, okay. Did I have my orders? Where'd my orders go? Got my orders, and then I have my med cards in my pocket. So I've got everything. I'm gonna come back and I'm gonna draw everything up here with my instructor. So I'm gonna set that to the side. Got my sharp, got all my meds, got all my supplies, got my labels, got my alcohol swabs, got my vials, and I've got my oral meds. So the first thing I'm gonna do is I'm gonna go ahead and do my 6 rights again on all of my meds, okay? So first I'm gonna look at my oral meds and I'm gonna do right patient, yep, Kelly Patel. I've got metformin, 500 milligrams, 500 milligrams, right time, 8 a.m., yep, 500 milligrams, twice daily with meals, twice daily with meals, okay. Expiration date is 2040. Okay, her metformin is good to go. Next, I'm gonna look at the ondansetron. I've got 4 milligrams per 2 mLs, 4 milligrams IM every 6 hours as needed for nausea. I'm gonna look at the last time that she had it. It was over 6 hours ago, so I'm good to go ahead and give her this dose. Let me look at the expiration date on the vial. 7/20/24. Okay, I'm good to go with the ondansetron. And then let me check my NPH and my regular. Okay, I'm gonna give 6 units, 10 units of the NPH, 6 units of my regular before meals, before breakfast, 8 o'clock. I also have to come over here because my sliding scale was 192. So I'm gonna give 2 units of the regular, 6 plus 2 is 8 units total of my regular, and then my NPH was 10 units, and then I know I'm gonna give my insulin sub-Q. Let me check my expiration date, 7/24, and then this one.
You look like me now. That's what I do.
8/22, I think 6/22. Okay, good to go. So all my vials are good to go. I did my rights of administration, and I'm gonna wait to document until after I give the meds. So I'm all right. I'm ready to roll and draw out my medications. So I'm gonna put my orders here. I'm gonna set those there, and what I'm gonna do is go ahead, so I don't forget, to set an alcohol pad on top. It might not sit on top, but usually I set it on top of each of my vials. I'll scrub them for 20 seconds, scrub, 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 scrub. I withdraw all of my medication, okay? Remember your cloudy to clear. Remember, check your doses with your instructor, especially on your insulin because it's a high alert medication. And then do it on your IM medication because we just want to be able to verify your dose. So I've got everything drawn up. I'm going to do them one at a time, but I'm also going to remember to fill out my labels. So remember, this label is really only for you. I'm going to put on here my dose. I'm going to put what medication is and what route I'm going to give it. And then I'm not going to hide my, what do you call it? Like numbers, so I can see what it is, but I'm just going to tag that on there at the very bottom so I can see what it is, okay? So I've got everything drawn up. So what I'm going to do is put everything back in, okay? Remember, when you switch out your blunt, your blunt tip, okay? Do not, what did I see everybody doing yesterday? Girl! Sorry. Do not, do it with your fingers, or that doesn't make any sense, but you know what I mean. Make sure that you are, so I just, drew up my meds. Make sure that you are scooping, okay? because that's a safety thing right there. You'll be unsuccessful on your attempt right there if you're trying to like put it on like that, okay? Could you probably do it? Yeah, maybe. But if you're busy, you're running around, you're doing a bunch of stuff, you are probably going to stab yourself, okay? So that's gonna be a safety tip. So all you wanna do is just put it on the very edge of your table, and then you will scoop and click, okay? Then you'll be ready to put it in your sharps, and then you can go ahead and put on your new cap. Okay? Put on your new cap. Make sure that you twist it on. Put your little safety thing down because you're not ready to use it yet, and then you can put it in. Okay? So let's say I already drew this one up. Boom, 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 bam. They all have their labels on. Okay? Good to go. We'll have a little trash can right here for you so you can throw all of your old items away. Boom, boom, boom. Throw everything away. These are my old labels. I'm gonna put some alcohol swabs in here so I can go ahead and give this to my patient. I'm gonna put my vials in here so I can go ahead and put them back at the med cart before I go into the patient's room, because you don't wanna leave your vials sitting here because you can't leave meds unattended, okay? So now I'm ready to go into my patient's room. So I'm gonna get my orders. I've got my med cards, okay? And I'm gonna get my glass of water for my patient. So, before I go into my patient's room, I'm gonna stop at the med cart. I'm gonna put all of my meds back. Regular, page, Dansitron, and now I'm ready to go into the patient's room, okay? So I'm gonna go over, knock, knock, knock. Can I come in? Okay. Hi, I'm Jessica. I'm going to be your nurse today. I got your medications. Are you ready to take them now? Awesome. Can I just have you verify your full name and date of birth for me? Is it okay if I check your armband? Awesome. All right. Kelly Patel, 9/7/1972. Perfect. Miss Patel, can I call you Miss Patel? Awesome. Are you allergic to any medications? How about anything else? No? Perfect. Well, I've got your medications that your doctor's ordered for you. Is it okay if we go ahead and sit you up so you can take them? Okay. I'm just going to wash my hands and I'll shut your door and provide some privacy, okay? Some hand sanitizer. I'm also going to put on some gloves. Is that okay? Okay. Put on my gloves. I'm going to sit my patients all the way up. Okay, I'm going to sit her up. I put the bed up a little bit, okay? First thing we're going to do is take your oral medications, but I'm just going to do one last check of the medications because I want to make sure I've got the right patient and the right meds for you, okay? Awesome. So, let me do my check. All right. Now, all this stuff won't be here, so you'll have a little bit more space. All right, I've got Kelly Patel, 1/2/1972, and I've got your metformin, 500 milligrams, PO, twice daily with meals, and so it's time to take it at 8 a.m., okay? Then I've got your ondansetron, 4 milligrams, IM, every 6 hours as needed for nausea, and the last time you had it was over 6 hours ago. And then I've got your insulin, and this is mixed, but I've got your regular insulin, 6 units sub-Q, but I've also added 2 units because your blood sugar this morning was 192. And then I've got your NPH, 10 units sub-Q, and this you take before breakfast. Okay. Awesome. Okay. Ms. Patel, is it okay if I tell you a little bit about your medications you're taking this morning? Okay. So first I've got your metformin, and metformin is actually an anti-diabetic medication because you have diabetes. So sometimes with diabetes, your blood sugar can get a little bit too high. So this medication is used to help regulate your blood sugar. But sometimes there are some unwanted side effects. Sometimes it can work a little bit too good, and it can cause your blood sugar to drop a little bit low. So if it works a little bit too well, and you start to experience any of the symptoms that I'm going to tell you about, I want you to hit your call light so that way you can let me know. If you experience any dizziness, if you get a headache, if you start to feel a little bit lethargic, like a little bit spacey, kind of confused, disoriented, if you start to sweat all of a sudden, hit your call light. I want you to come and let me know, okay? The next medications are your insulin, and they kind of work the same for diabetes. It's because your blood sugar can sometimes get a little bit too high. Your body doesn't regulate the blood sugar that you kind of get when you eat certain foods. So, same thing. It can work a little bit too well sometimes. So, if you start to feel dizzy, lightheaded, if you start to feel confused, if you start to sweat profusely, hit your call light, and I want you to let me know, okay? Now, the ondansetron is for nausea. Your tech let me know that you were feeling a little bit nauseous, so this medication is an anti-nausea medication. It's supposed to help with some of that nausea that you're feeling. Now, I'll come back and check on you in about 30 minutes, especially before breakfast, but if your tray is late, if you don't experience any relief of your nausea, if you actually have some vomiting, headache, constipation, diarrhea, anything like that, I want you to hit your call light and come and let me know. Any questions? Awesome. The first thing we're going to do is take your metformin, and this medication is oral, so I'm just going to open it if that's okay with you and you're okay with taking it. Yeah? Awesome. Okay, so I'll go ahead and open it. Okay? And then I've got some ice water for you, okay? All right. Just open up wide. She's sitting all the way up, right? Okay? There you go. Take some good sips of this water for me. Okay? See that you took it. Perfect. All right. Next, I've got your insulin, okay? And this we're going to put in your stomach. Do you remember where the last spot you had it is? I just want to rotate spots. Sometimes if we keep going in the same spot, it can make your skin a little bit tough. You had it on your right side last time? Your left side? Your left side? Okay, we're going to put it in your right side this time. I'm just going to scrub the site really, really good before we give it. Okay, now I'm going to let that air dry. All right. Now I'm just going to pinch up the skin, and I'm going to insert at a 90-degree angle, okay? I've got on gloves and everything, okay? Now I'm just going to let it kind of sit, hang out, and then I'm immediately going to put this in the sharps, okay? Now you walk over and put it in the sharps, okay? Don't recap, but walk over and put it in the sharps. All right. Now lastly, we have your ondansetron, and this medication actually goes into a muscle, okay? Now this is going to be 2 mLs, so it's a bit too much to put into your deltoid, which is up in your arm, especially because you kind of have smaller arms. So I'm going to put it into your thigh. Is that okay? Awesome. Okay, so what I want to do is just kind of position you so I can reach your thigh. So I'm just going to put your bedside rail down, and then I'm going to pull your blankets back a little bit, just going to expose your thigh. Is that okay? All right, I'll try to keep you as private as possible, okay? And so what I'm going to do is just mark your land sites or your landmarks, okay? And I'm just going to go right there into the middle of your thigh, all right? Awesome, okay? Just gonna scrub the site. Now this I'm also going to insert at a 90-degree angle, okay? Ready? 1, 2, 3. Insert, activate your safety. And I'm going to walk over to the sharps container. Boop. All right, Ms. Patel, is there anything else that you need? You did quite well with those injections. Sometimes people get a little scared, but you did amazing. All right, I'm gonna come back in and check on you in about 30 minutes just to see how your nausea is doing, to see if you're having any side effects. I also wanna make sure that your breakfast tray is coming back up, just because we give you those medications and they can drop your blood sugar. So I wanna make sure that you have breakfast so it can, help bring your blood sugar up a little bit. Is there anything that you need from me before I go? Would you like to sit up? Okay, then I'm just gonna put your bed all the way back down. I actually have to come back in and do a dressing change on you for Foley catheter insertion. So I'm just gonna go out and gather your supplies, but I'll be right back. I wanna make sure that I have everything. I'm gonna make sure that you have your call light just in case anything happens while I'm gone, in case you have any side effects or anything like that to those medications that we gave. But I'm gonna document that I gave you your medication and then gather all my supplies for the Foley, and I'll be right back. Awesome. All right, John, that's it. That's it.